The apparent murder of United Healthcare CEO Brian
killed the top executive of America's largest private health and
shot and killed the United Healthcare CEO.
Shot in front of the Hilton Hotel.
Surveillance video captures the moment a masked man pulls a gun with a silencer on United Healthcare CEO Brian Thompson Wednesday morning just after 6:45. We're freezing the video before he shoots the 50-year-old father of two.
On December 4th, 2024, Brian Thompson, CEO of United Health Group, the largest private health insurer in the nation, was shot and killed outside his home. The news stunned the nation. Executives called it a tragedy. Industrial leaders offered their condolences. But then, something unexpected happened. Thousands of Americans started celebrating, calling an assassin a hero.
Guess what happened next? Internet users began dropping negative reviews for that McDonald's. They called the staff rats and snitches.
Why would the nation celebrate the death of a healthcare executive? The answer lies in the system, built not to heal, but to profit. As of 2021, over 31 million Americans were uninsured. Even those with coverage faced steep deductibles, surprise bills, and denials for medically necessary treatments.
Is not very likely. Federal data shows that companies issued more than 49 million denials in 2021.
Companies like United Healthcare deny people care every day and drop people from care every day.
The private health insurance system in the United States has long been criticized for its inefficiencies, denial practices, and unaffordable costs. Patients often face coverage gaps, surprise bills, and delayed treatments not because the care doesn't exist, but because their insurance won't approve it. To get to know about this problem better, I reached out to Cox Health in hopes of speaking directly with patients or healthcare professionals. But despite multiple visits and requests, no one was available for an interview. Schedules were full and access was limited. As I couldn't get any interviews at my local hospitals, I changed direction. Instead of just focusing on United States private insurance, I spoke with my father, a doctor in South Korea, to learn about how universal healthcare works from the inside.
한국에서의 국민보험에 대한 전체적인 만족도가 어떠세요?
한국 사람들 만족도 좋지. 아주 좋아. 왜 그러냐면 다 의료보험이 돼. 근데 간혹 가다 보면은 일반 의료보험이 안 되는 게 있어. 그런 건 이제 사보, 아까 말한 실비보험에서 해결하고, 우리나라만큼 이렇게 만족도 좋은 데는 없을 거다. 왜 그냥 우리나라 의사들 실력이 거의 선진국 수준이고, 그리고 일부 의사들은 손재주가 좋아서 선진국보다 더 좋아. 이걸 다 의료보험에서 하니까 얼마나 만족도가 좋니. 근데 우리나라 사람이 어떻게 자기네들은 만족도를 몰라. 왜 그러냐면 여기서 사니까. 근데 이 사람들이 외국을 나가보잖아. 미국이나 이런데. 그러면 그때서 야, 이게 우리나라가 이게 참 잘하는 거구나. 그렇게 다 만족해.
의료비 때문에 한 번이라도 딜레이 된 거 본 적 있으세요? 처치가?
아니, 없어. 워낙 다 싸기 때문에.
국민병원 합쳐도? 한국병원
어?
합쳐도? 한국병원 합쳐도?
대부분 다 해.
아니,
그리고
아빠 옛날에 레지던트 했잖아.
그때도 다 했어. 다 해. 웬만한 가격은 다 되고, 그리고 웬만큼 월급쟁이도 다 진료받을 수 있어. 그리고 진짜 가난한 사람은 의료보호로 해서 돈을 거의 안 내질 않아. 한 푼 내는 게 거의 뭐 빵이야, 빵. 빵 내지 뭐 1,000원 이거밖에 안 돼. 그리고 이제 나머지 중간에 이제 의료보호 아니면서 그런 사람이 있어. 가난한 건강보험 환자. 이런 사람들은 사실 돈이 없어서 못하지. 근데 대부분 그런 사람은 구제해줘. 우리나라가 의료보호로. 파산자가 의료보호를 이렇게 해줘. 왜 그냥 미국은 1,000만 원 넘게 받거든. 근데 여기는 100만 원 받는데 그것도 건강보험을 하잖아. 자기는 10만 원 밖에 안 내. 10만 원, 15만 원.
이게 의료 퀄리티가 제약이 있다 생각하세요?
아니, 더 좋아졌지. 국민건강보험이 사실 아빠가 의사들을 봤을 때는 사실 그게 없는 게 더 이득인데 이 아픈 병원이라는 게 환자들이라는 거는 꼭 이렇게 돈만 보면 안 돼. 공적인 문제도 있어. 그래서 이제 의료보험 하는 거는 잘한 거야. 근데 너무 저주가 정책이야. 그게 좀 무섭지. 지금 일본이 한 8분의 1에서 10분의 1 되고 미국이 한 15분의 1 돼. 그러니까 우리는 박리담회식으로 환자를 많이 보니까 미국이 한 6분의 1 가격으로 보통 버는 사람이 6분의 1 정도 수입이야. 근데 그게 너무 저수가 정책에서 이거 수가가 한 지금부터 한 1.5배에서 2배는 난 더 돼야 된다고 봐. 알았어.
충분히 넘어.
환자가 한 명 수술한 적. 바이바이.
After interviewing my father, I saw the contrast between the universal healthcare and the United States private insurance model better. In Korea, universal coverage allows patients to focus on care, not cost, while private insurance is used to supplement, not gatekeep. But in the United States, private insurers often control access, delay treatments, and deny coverage to protect their profits. What stood out the most from this interview was his reminder: good healthcare requires sacrifice. In Korea, doctors sacrifice time and earnings to serve more patients. In the United States, it's the patients who sacrifice delaying treatments, going into debt, or being denied care altogether. A system built around the profit will always fail people. Universal care may not be perfect, but it puts care first, and that's what we morally need. So, what can we actually do to make a difference? First, we can support policies that expand access to public healthcare. One example is going to be the Public Option Act, which would allow people to buy in a government-run health plan like a Medicare. If you're old enough to vote, you can go vote the policy and advocate it. If you're not old enough to vote yet, you can still raise awareness by sharing information on social media or writing letters to local representatives or participating in school clubs such as HOSA to focus on public policy and health equity. You can also volunteer at hospitals, clinics, or non-profit groups that advocate the healthcare access. And lastly, you can educate yourself and the others. Talk to your classmates and talk to your families. Help them to stay informed about healthcare issues, insurance system, and reforms through articles, documentaries, and podcasts. As students, we might not feel the weight of the healthcare system yet, but we will. One day, we'll be the one paying premiums, navigating coverage, or caring for loved ones through it. That's why now is the time to understand how the system works and how it fails. Because even if we're not dealing with it today, it's our future on the line. We may be young, but together, we have the power to demand better and build a healthcare system that puts people first.